Our next innovator is a Dell innovator, Daniel Boyd. Daniel has a PhD relating to hard tissue biomaterials and has licensed multiple technologies in the medical device space over the past 8 years and has founded spin-out companies in both Canada and Europe. His current position is that of clinical scientist and professor cross-appointed to the faculties of dentistry, medicine, and engineering here at Dalhousie University. Daniel's research group is focused on the development of therapeutic, regenerative glass-based biomaterials for clinical indications in the areas of trauma, oncology, neurovascular interventions, and hard tissue augmentation. Daniel will share his passion for innovation and the path that has led to multiple technologies using glass biomaterials. Ladies and gentlemen, Daniel Boyd.
Houston, we have a problem. Those words were delivered by Commander Jim Lovell from space in April 1970. An oxygen tank on Apollo 13 had just exploded. It left the crew in a position with no power or breathable air. As 4 astronauts, 56 hours into a flight, stranded 200,000 miles from home. What's important is what happened next. What happened next was a conversation, a series of conversations. Conversations that led to creativity and innovation at a level that is unprecedented. You know, as a professor, I'm really fortunate. I get to work with amazing people, fantastic students, people with amazing ideas. Ideas that, if realized, there's no doubt they could absolutely impact the landscape of human health, economies, or societies. But I also meet students who are of a mindset that because they're students, they believe they don't have the skills to succeed. And they let failure, or the idea of a failure, come between them and their absolute ambition. Well, you know what? We're all students, and I don't care how many letters you have after your name. We are students, all of us. A student to me is just someone who has a deep passion in a particular subject area. And failing, as we've just heard, failing, it's going to happen. It's innovation, right? It's an inevitable part of innovation. It is what makes the process tick. So, to me, the astronauts on Apollo 13, they became students. They became passionate about surviving. They became passionate about finding a way home. They became passionate about creating and innovating new solutions in a set of circumstances that had never been envisioned before. So it's I grant you, it's an extremely tough example I'm giving, right? An extremely challenging scenario. But as innovators, we can learn an awful lot from the crew of Apollo 13. Innovation is not just about science and tools. Innovation, without question, is about a mindset. A mindset that says, I don't care how difficult this is going to be. I care that we get it right. I care that we find a solution to this problem. As an innovator, you're not expected to have all the answers, but you are damn well expected to go to the ends of the earth to find the solutions to the problems that you care about. That means asking good questions. And asking good questions means having good conversations. So my advice, and we've been asked to speak on advice, my advice on how to identify exciting problems, how to get inspired, how to overcome challenges, and how to find a pathway to innovation, it couldn't be simpler. Have conversations. Have lots of them. Have them face to face. Have conversations where you listen more than you speak. If you have these conversations, you're going to find yourself dealing with people who share your passion, who share your vision and who want to be involved in enabling you get to where you need to be. So with that being the case, I thought I should share a couple of conversations that I think have put me on this path, right? And I've been fortunate to have some amazing conversations with some amazing people. I've been fortunate to have good discussions with my mom, my dad, brothers, sisters, my wife, Louise, who's here today, my daughters, and my son. But there's one conversation in particular that I think I should share with you. It's a conversation I had with my older brother, Gary. It's a conversation, it's a bloody sharp conversation. I said to Gary when I was in grad school, I love glass. I love glass science. And I love the idea of treating diseases and helping patients. I want to work with doctors. You know what? Maybe I even want to be a doctor. I don't know, but I love glass and I love medicine. And Gary listened to me talk. And if you knew the guy, you know, he can land one on you real quick. He let me talk, and then he stopped and he said, I dare you. I dare you find a way. That was one of the shortest, most impactful conversations that I think I have ever had. I think about that conversation every day. The conversation sent me down a road. It sent me down a road that has allowed me to work with some of the most amazing people around the world. It led me down a path, by the way, that I don't know where it's going to turn yet, right? But it led me down a path where my passion for glass science and medicine has allowed me to start this research program, this really well-funded research program, where we look at brand new glass materials and how we can use these materials to treat different types of diseases, everything from fractures in a spine to liver cancer. It's also led to spin-out companies that generate real jobs and have the chance to significantly impact human health on an international scale. That path has also allowed me to achieve what I thought was previously impossible, going from a Post-it note to a tool that will be used in clinic. And here's the thing, and I promise you this, I'm not sure any of that would have ever happened if it wasn't for a conversation with my brother. You've got to have conversations. So I'm going to tell you, right now I'm going to plant a seed, because I know there's additional innovators in the audience today that won't be up here getting recognized. I want to plant a seed. I want to plant a seed of a conversation that you need to go have with yourself first. Then let it blossom, let it grow, let it become something that you want to talk about with other people. Here's the seed. I dare you. I want to move to another conversation. And it's the last conversation I want to talk about. This conversation I had with an interventional radiologist, someone who finds a way to treat uterine fibroids, the number one cause of hysterectomy. He finds a way to treat that cause without removing someone's uterus. He finds a way to extend the life of patients with liver disease by 6 to 9 months. He's one of the most wonderful and innovative physicians that I've ever met. His name is Dr. Bob Abraham. And Bob and I, you know, we met as a result of conversations. Bob had a conversation with someone called Barbara, who was here at the university in the Industry Liaison and Innovation Office. And Bob got to Barbara and he explained, you know what, Barbara, I got this cool treatment, this elegant treatment that really helps people. I just take a small, flexible straw, it's called a catheter, and I insert it in their femoral artery, and under live imaging, I guide that flexible catheter into the vessels feeding a tumor. And then I just inject particles, tiny particles, the size of table sugar, through that catheter, and it blocks blood flow into tumors. I can treat tumors in a day procedure. It's real effective. Procedure is called embolization, but Bob had a problem. Those little particles that he delivers through that catheter, he could never see on X-ray. So he never knew if he completely covered or treated the full tumor. He needed a bead that he could inject through a catheter that would be imageable. It's a simple problem. What's really funny is I arrived in Barbara's office about a week later. I didn't know Bob at this time. And I said to Barbara, you know, I've been doing a lot of research trying to find ways to get glass to treat disease. I came across this thing called embolization. It looks like the physicians in this space might need an imageable bead. I can make one. Yeah, Barbara just laughed, right? Barbara called Bob. Bob and I went for beers. Bob and I had a conversation. We had an open-ended conversation, a conversation that lasted for hours, a conversation that refined a project idea, brought us to feasibility, brought us to proof of concept. The rest is history. Today, ABK Biomedical is a thriving company here in Halifax, has been supported by an untold number of agencies and people in this region and beyond. And it is now researching, developing, and manufacturing imageable glass beads to treat liver cancers, to treat uterine fibroids, and to treat any other number of hypervascular tumors. And it all happened because of some conversation. So I'm going to close on this. I'm going to close with saying innovation doesn't run smooth. By nature, it can't. Sometimes you're going to find yourself in really difficult places. You know, you might be running out of money, people's jobs might be on the line, a critical test that you needed to pass, you've just failed. You'll have untold numbers of unforeseen challenges, but you'll get through them if you have honest passion, because that passion will drive an honest commitment. And if you pair your passion and your honest commitment with one other thing, conversation, you give yourself the very best chance to succeed. If you don't believe me, go look at Apollo 13. Thanks.